My name is Douglas Stevens. I'm a facial plastic surgeon in Fort Myers, Florida. And today we're going to talk a little bit about facelifts. Facelifts have been around for a very long time, even back to the Egyptian times, but the techniques have changed with the understanding of repositioning not just the skin, but the deeper structures of the face. And that includes the malar fat pad, which is an area that earlier techniques didn't really address. The most recent facelift techniques also have emphasized a more vertical lifting technique rather than the more posterior or backwards pulling on the face. And this, of course, is more natural looking because gravity doesn't pull sideways, it pulls directly down towards your feet. So a couple of key goals is to have the incisions be located so that you really can pull your hair back in any fashion that you like, and to protect the anterior hair tuft. And to line up the posterior hairline. So the incisions typically wiggle around the anterior hair tuft in the creases around the ears, behind the tragus, and then behind the ear where nobody will really see them unless you kind of pull your ear forward to show them that. And then on people who need some extra efforts down in this area, in the submental area, there might be a 2 centimeter incision in the natural crease just below the chin. But those give access to tighten up the facial musculature in the neck, to remove fat, which sometimes needs to be done. And then also in the face to elevate the SMAS layer, which is the tough layer over the facial muscles, and actually put the upward tension on that structure, which will be able to maintain that rather than on the skin, which will ultimately relax, and in a year or so you'll look the same as you did before. So the goals with the facelift then are to elevate and resuspend structures, remove excessive fat, and give contour to the jawline, to the neckline, and to elevate the malar fat pad to get that nice fullness over the cheek rather than when that descends, adding fullness down into the lower face. Typically a facelift is done under anesthesia, and what kind of anesthesia really can be worked out between you, your surgeon, and the anesthesiologist. A facelift can take somewhere around 3 to 3.5 hours, depending on what other ancillary procedures might be done at the same time, like if you're doing your eyelids or laser resurfacing to freshen up the surface of the skin, that will add a little bit more time to it. And the recovery, typically there's a big bandage on the first night. Sometimes drains can be used. They all come out the next day, and a smaller bandage is used just to support the submental area. Sutures are usually removed around a week after the surgery, and most people can kind of go out looking fairly decent at around 10 days to 2 weeks. Numbness will persist, and that's very variable amongst people. Could be 2 weeks, could be 6 months. Typically, numbness will go completely away. Once in a while, there'll be a quarter or a dime-sized area that may persist to have some alteration in sensation. But the main goal is obviously not to have any damage to the nerves that move the face, and to have a nice and natural, refreshed look. I think one of the key things with facelift surgery is the condition of the skin. So if the skin is in poor condition, it's worth it to do some things to get that skin in better condition, I think, before the lift and even during the lift. So before the lift, often we'll have people do radiofrequency microneedling treatments. And then during the lift, if they need additional, we'll pull out the CO2 laser and perform CO2 laser resurfacing, which can be done simultaneously with a deep plane facelift because the vascularity remains intact with that technique of surgery. I think, well done facelift is, a major improvement. It's hard for anything else really to compare to it. But we do have other ways to improve tightening, such as Face Tight, AccuTight, and radiofrequency microneedling, which in our office is called Morpheus. They are going to give you some tightening and elevation, but really nothing can beat a well-done facelift when it comes to resuspension of the structures of the face. Well, that's the end of our video today. Thank you for watching, and if you'd like, come in for a consultation and we'll talk more about the options of facelift versus radio frequency devices. Thank you.